Will was told, like many others, that COPD was incurable. He found that was not the case. And here's what I appreciate about you doing this, by the way. Other people out there say, I don't have any other points of view. My doctor told me this is what I'm going to do. All of a sudden they go on and go to YouTube and say, this guy had the same problem and he got solved with this guy. Well, honey, let's just try that guy first, maybe. Because if he's probably telling the truth, he's probably not doing this for this guy's advertising. He's probably telling the truth of what's going on with him. If he can help that guy, maybe he can help me. That's what this is all about.
Well, and you know, because I sent a lot of nurses to you and people to you and so forth, and you worked on so many different things and would help them. That was impressive to me. It's just like now, Lynn, it's like, well, it's your lungs. It's not your back. He can't do anything about your lungs. I said, yeah, I've seen him get rid of migraines. I've seen him get rid of back pain. I've seen him get rid of a lot of different stuff.
Body's remarkable.
Yeah. And well, how does he do that? My cousin was like, well, what does he do? How does he do it? And I said, go see. Go find out.
Come on, we'll have a conversation. See, we help you. Start from there.
Exactly. Okay.
All right, so this is a new one. So if you introduce yourself again, like this is brand new, that you have the COPD, is the thing. There's a lot of people out there with this one. So they heard that terminology.
Yeah, that's true.
And once they heard that terminology, I got it, it's a lifetime. No, it's not a lifetime thing. So I'd like them to understand, just like the thing with your back, this is not a lifetime thing. We just got to identify what the problem is and correct the problem. So you're on stage again.
Okay. My name is Will. And I would like to, going back, I would like to explain that I smoked. Actually, I smoked for 50 years to the year. And it caused me to have lung problems. I had COPD. And COPD, according to medical doctors, is incurable. You can't cure it. But I got to where here recently, I couldn't quit coughing. I coughed day and night. It kept me awake, and I had a real bad time. And that's when I said, I'm going to go see Jack. And I came to see Jack. He checked me from top to bottom and cleared some things up, and I haven't coughed since. That was one time, and I have not coughed since. And that was like 2 months ago.
Yeah, probably about a month ago, actually.
A month or two ago, and I have not coughed since.
So how many visits did it take for you to finally stop coughing?
One.
After one visit, you stopped
One
coughing?
visit, yes. I had one visit, and I never coughed again. Well, not like I was doing before, because it was a deep, real bad cough. I had some fluid in my lungs, and but it cleared it out, and I haven't had any problems since.
All right, good. So we've seen each other about 6 or 7 times now. So how are your lungs now? Do you feel like you're breathing any better? Or?
Breathing much better. I have no problem with breathing. I can walk further. Yeah, and my lungs are much better.
Good. Are you taking any medications at all for your lungs? Breathing?
No, not anymore. I've come off of all my medication. That's what I wanted to do.
I didn't know we should say that. maybe Lynn might see this.
Yeah, I was going to say Lynn's not happy with me doing that. But well, some of my medication is for other things too, like blood pressure and what have you. So, but as far as the things, I was on some medication for an antibiotic for my lungs, and I'm off of that. I'm off of a cough medicine. I'm not taking anything for my lungs right now. And it's much better.
Good. Well, we didn't talk about, I suggested that you didn't just come off it, you talked to your doctor before you came off. Did we talk about that? Did I mention that to you?
Yeah.
Yeah. So I don't ever take people off medications.
No. Okay. This was my idea. Okay. I've been in medicine for 50 years. So I know a little bit about medicine, been to a lot of different kinds of doctors and so forth. And no, this was not Jack's idea. This was my idea. I was like, I hate taking medicine. I don't like taking medicine. First of all, I've got a throat problem or had a throat problem and I can't swallow medicine. It sticks in my throat, so I hate that. I don't mind shots so bad, but I don't like taking medicine. But I have not had to take it lately because I'm not having the problems.
Good. So about 3 weeks you've made pretty remarkable changes, I guess.
Yes.
Good.
Yes.
Good. All right. Do you want to say anything to anybody out there who might have COPD or doesn't like their drugs and medication?
Well, just let me say this. As I mentioned, I've been in medicine for 50 years, and I do know that the doctors tell you there is no cure for COPD. Well, I'm not saying there's a cure, but the side effects and things that it causes and so forth, you can stop those. And that's actually what happened to me. If I have COPD, I have no more coughing, no more bad effects of it. It's all gone. So it's the same thing, and it's a great feeling. It's a great feeling. COPD is a bad thing to live with. You're short of breath, your heart takes a beating, and to get relief is wonderful, wonderful.
Great. Thanks. Good job. So if you heard your story through Will, call Dr. Winter at 770-536-6600.